Good afternoon, everybody, and welcome to the BC Health Coalition's Workers' Mental Health Panel. I would like to start with a land acknowledgement. We acknowledge that we are here today on the Coast Salish nations of Musqueam, Tsleil-Waututh, and Squamish territory. We also acknowledge the many territories and lands across Turtle Island that you may be joining us from. We are honored to be here as guests on this land that Indigenous peoples have cared for and continue to care for. We invite you to take a moment to think about where you presently live and honor the people of the land. Think about your relation to the place you live, work, and interact. This is our inquiry to honor the past and present and to stay connected to decolonization practices. We invite you to use the chat to share the name of the territory or land from where you are connecting from as part of this acknowledgement. And thank you for doing so. I'd like to just take a brief moment to introduce myself and my co-chair. My name's Tanya Patterson. I am the CUPE National Representative, Health Sector Coordinator here in BC. I'm also a member of the steering committee, and I'm accompanied by my friend and co-chair, Edith McCaddy, who is the HSA rep on the steering committee. Just a couple of things before we continue. This event is recorded. A link to the recording will be sent to webinar registrants within a few days. The video will also be available at bchealthcoalition.ca. We would like everyone to note that the chat will not be monitored. Please limit side discussions to minimize distraction. There will be an audience question and answer after the panel discussion, and you'll be able to submit questions for the panelists at any time during the event by using the Q&A function at the bottom of your screen. Questions posed in the chat will be missed. We do apologize in advance that we may not be able to ask everybody's questions. We also want to acknowledge that discussions about mental health may involve sensitive topics and can be difficult. We honor the risks that our panelists take in sharing their experiences. We encourage everyone to practice self-care and take breaks from any of the discussions as may be needed. We have a link here that you can follow in the chat, which has a list of mental health resources for adults and youth. I just want to, just to give a little bit of context, mental health has been significantly impacted by workload. We put out a recent workload survey where 73% of respondents indicated that their mental health has been affected with workload, with the pandemic, and we know that in essential sectors, worker shortages are already an issue and have just been made worse through the COVID-19 pandemic. And with that, I'm gonna pass it over to my friend Edith.
Thanks so much, Tanya, and yeah, really happy to see everyone joining from across our wonderful province. So my name's Edith again. I'm one of the co-chairs of the BC Health Coalition and a rep for my union, the Health Sciences Association. I'm an occupational therapist during the day at a public child development center. So I'm just going to give you a really brief overview of our agenda. So we're all here and very fortunate to have 4 wonderful workers to share their frontline experiences. So we're going to have a worker panel. There will be time for audience Q&A. Just another reminder to use the Q&A function, so not the chat box. So if you click on the Q&A, then you can input your questions or comments and we'll make sure to review those with the panelists. We're going to have a few remarks after the panel from myself, situating worker mental health within the broader vision of public mental health care. And then we'll have a wrap up in terms of talking about what you can do to support workers and public mental health care. So now I'm so pleased to introduce Jean Kavanagh. Jean Kavanagh will be our moderator for the worker panel, and she is the media manager for the Canadian Centre for Policy Alternatives, the BC office, and she's worked in communications for nonprofits and government agencies. Before going to the dark side, as they call it in journalism, she was a reporter and editor. So thank you so much, Jean, and I'll turn it over to you to introduce the panels.
Thanks so much, Edith. Hi, everyone. And yes, thank you so much to our 4 panelists. Today we've got Andy Healy, who's with CUPE Local 1004. Andy has been a frontline mental health worker in Vancouver's downtown east side for the past 20 years. He's currently a day shift coordinator at one of the temporary modular housing projects operated by PHS Community Services Society and an activist with his union. Chris Halauka is a member of UFCW 1518. She's been a cashier at Save-On for 33 years. She's also a shop steward, health and safety worker chair, and has served on the UFCW 1518 executive board since 2012. Chris has recently accepted a chair position on the UFCW 1518 Provincial Indigenous Committee. Angelo Moroney works at Watari. He is the peer community support counselor at Watari Counseling Services and was an outreach support worker at the Downtown Community Court. Throughout 2020, he supported migrant farm workers with mental and physical health practices, as well as informing them about their migrant worker rights in the times of pandemic. Easter Takal is a social worker working in hospital and social services for almost 20 years. She belongs to the Health Sciences Association of BC and is currently an outpatient social worker working in cancer care. So the first question is for everyone. Maybe we can start with Andy and people can introduce themselves, say their name. So just wondering if you can tell us a bit about yourself and what a day at work looks like for you. And if that's changed, if there's been a big change in that since COVID started. Andy, do you want to go ahead?
Oh, where am I? I'm trying to, hang on. Okay. My thing's spinning. Hang on. Oh, there I am. Okay. My day, a regular day, it's a bit of a mishmash. I work at a building that houses 52 people, and these temporary modular housing projects came on board when it was like a response to homelessness by the city and the province, and so we took people who were homeless in the area and moved them into a place. So everybody who lives there was formerly homeless. So there's a lot going on. So I help run the building and see to the needs of the residents there. So it can be everything from mopping up messes and helping people tidy their rooms and medication administration and talking to doctors and getting people to appointments. We've got a little OD prevention room, so people are in there and they inject their whatever they're using, and we keep an eye on them, and we attend overdoses as needed, and it's just a bit of everything. Change during the pandemic has been more focus on wearing PPE everywhere. It's been difficult, and trying to get residents to wear PPE around, and it's hard to do things. Our OD response has been different. At the beginning they told us don't use oxygen, so it was really scary. You'd come up to somebody who'd been overdosed, and the protocol was to hit them with Narcan and call 911, where normally you'd give oxygen and CPR and whatnot. So that was really scary and really stressful. Things have sort of chilled out on that, and we have different protocols now. Look, there's been different things from BC Housing, like directives for visitors into the building, so things are tighter, just stresses people out. It just adds to just more and more daily pains, but we're adaptable, and the people that live there, the residents, I mean, they're incredibly adaptable at everything. So we roll with it.
Great. Thanks, Andy. Chris, do you want to tell us how things are?
Hi, I'm Christine Halauka. I come from the Lake-Tenay in Prince George. I've been a cashier for 34 years. It's a long time. And there have been some huge changes since the pandemic started, of course. The day starts out like normal. We open at 8, but we work behind plexiglass now, which was a battle to get. It was a health and safety issue, but it's fine. It's up. The traffic of customers has come in heavier than normal. I think a lot of that has to do with the fact that there's nothing else to do for people really other than to cook and eat, as we all know from the winter storage we've put on. My coworkers at first were afraid. We were all afraid. There was no questions, no answers to anybody's questions. It was such a new thing for everybody. So, adapting to PPE, stricter cleaning protocols, which probably should have happened in the first place all along. We've learned some lessons about life on that. But I would say the biggest change has been until now, like it was the massive crowd. It was like Christmas for 5 months, only there was no joy and people were afraid. And that of course affected a lot of our coworkers. I started to notice as a shop steward, and I've had some health and safety training, that the mental health of workers from all ages was being affected by so much negativity and anxiety. We had no control over how many people were in the store. There were guidelines put into place, but unfortunately, a lot of grocery stores, a lot of retail sectors, I think they are more reactive rather than proactive. And as the guidelines kept shifting and changing and going back and everything, even at some point, our managers weren't sure what to do. They've been there for us when they can be there for us. They're cleaning just as heavy as anybody else. It felt like a disconnect from our main offices, I have to be honest, because they did work inside. They weren't working on the floor ground level with the public. It is different. And I've had more people come to me for advice on who to contact. They need time off. And just by watching, you can see when someone's having a bad day. We've gotten closer in a lot of ways. We've had to pull together. And it's not all bad, but when it's bad, it's very, very bad. It's now that time has gone along, I'm finding that the crowds may be less, but the anxiety level, the depression, and the anger of the public themselves with all the restrictions that have been put on place are really hitting our frontline workers in grocery stores and retail a lot. Restaurants, all that. You've seen it on the news. We've all read it. We see it everywhere. So yeah, it's been challenging, and every day we just put on our uniforms and we go forward, and we thank everybody who is tolerant and patient. And thank goodness that's about 96.4% of the population that comes into a grocery store, but that other 3.6% definitely is hard to take on a steady basis. And thank goodness for us, it's not always all that steady. So that's about what I've got for what our regular day is like. I can go on about the grocery industry and the people in it. I think seeing ages of all ages kind of collapse under this steady mental attack with anger and frustration and high anxiety is tough. We've had people leave for retirement much sooner than they planned. We have a lot of younger people, and when I say that, I say 30 and under. They're not all high school students either. They're not all university students. They're people just trying to make a living like anybody else. And it's tough because it's not the best of money, although we've negotiated some good things. But the anxiety that's hitting them and having them have to leave and look for help, search for help. We're thankful for some of the programs that are out there, but being up here, it's a little hard to get into them right away. And we could use more of that. We do have a company program, which is really good. And I know with mental health, a lot of people will come to you, but then after that, you don't hear anything else. You just know that they're not at work anymore. They've taken an extended leave, and it's usually an unpaid leave, which is another form of stress on top of everything else. So yeah, but we carry on with it. And it's just day by day for most of us, which is really good. But seeing people leave, and once they leave, they don't come back. I have to say this, there is such a worker shortage right now. It's unbelievable. You could get hired. There's 4 stores in my town, and all 4 of them are looking for people to come and work, especially during the day. And it's interesting that we have so many job opportunities, but the people just aren't coming forward because they've left retail, or they've left serving in a restaurant or anything like that. They're not going back. They're trying to find something else. So nobody really wants to return and face what's going on with the public right now. So I think that's pretty much answers my day.
Great, thanks, Christine. Angelo, do you want to tell us?
Good afternoon, everyone. Well, I mean, I do not want to repeat what Andy and Christine, and I'm sure everyone talks about, is the increased stress and anxiety that everyone as a collective, as a community, as a city, as a country, world experiences from this pandemic, whether one is requiring services, which we all do, or giving services. It's tiring. You know, my day is, you know I have to take care of myself a lot more, because then I will not be able to give the level of service that I want to give to the people, to the community. So that is something that, and also, of course, how it affects me with my anxiety, my stress. So that's something that has been a challenge for me, and I'm sure for other people. But now that we're getting into the winter, I mean, the numbers are still rising, or I think they are. I don't really look at the news that much anymore. It's tiring. It gets tiring, and everyone is tired. Everyone has anxiety, and even though we're like, okay, come February, we are going into 2 years in Canada. Not that much. I mean, there's been all of this, but then the anxiety levels or stress levels maintain. So my question is how, and I know this is time for a question, but that pops up, is there anything more that we can do, or that Canada as a nation, as people, as communities, to lower the anxiety levels, the stress? Of course, there's a lot of unknowns as well. So my day, going back to me, my day is taking care of myself, knowing what I need to do in order to service and meet people. But of course, I work in the downtown east side. There's a lot of resiliency. And also, I mean, there's a lot of people that really don't have the opportunity, I would say, maybe if that's the right word, to think about all of this. There's other more pressing issues that people in the community face. So they don't wear masks. They don't think about that, because there's other things that they are on their mind, things that they need for their daily lives. So in a nutshell, there's a lot of tiredness, but at the same time, in me, there's more care that I need to do. So that's about what I want to say now.
Great, thanks so much, Angela. Easter, I wonder if you can tell us how things are for you.
Hi, everyone. Good afternoon. I just want to say thank you to everyone and my fellow panelists who, dedicate their lives to serving their community. And just thank you for everything that you do. We don't hear that enough, and we don't get recognized enough. And I think it's really important. And so my day is like, I'm very tired too. It's been, I work in the hospital and I work in healthcare, and my workload is just increased. And I'm talking slow, but normally I talk like 100 miles a minute because it's just so busy here. And I think I interface with a couple of you guys already, some of the panelists, because like I have patients who need housing, and part of what I do as a social worker is I assess patients. I look at their emotional, mental health, emotional needs, social, psychological, financial. And so I provide assistance and advocacy, and I help people get resources. And so my day is all over the place. Like one day I'm, trying to help people access housing, access even oxygen, seeing new patients who are newly diagnosed with cancer, newly diagnosed with terminal cancers. I deal with a lot of trauma, and every day is a crisis. And since the COVID started, it's been such an impact. The hospitals are full. They're full now. We had all these changes, and people's anxieties are really high. A lot of what I do is helping people kind of navigate through the healthcare system. And so they don't, like, a lot of people are scared to go into hospital, but they need the care, and it's life or death. And so, and then even family members are scared to bring their loved ones into hospital because they don't want to be separated. And especially as, with patients dealing with end of life, so there's a lot of navigation there because we want to respect people's wishes, but at the same time, they need the care. And so just a lot of navigation. And my colleagues are extremely stressed. We're working short. People are retiring, people are quitting. It's a very scary time. But like everybody said here, there is resiliency. I see patients every day, and that's what keeps me going, is that they're resilient and they need us. Like one of my patients a couple of weeks ago said, like, Easter, I pray you're in my prayers every day because I don't want anything to happen to you, and so, I do the same. I'm at a point where there's nothing much that I can do. I can only give so much of myself. And I wake up every day, and I used to look in the mirror and look like, oh my God, you look awful. But it's like, no, I've been asking myself, like, what do you need today? What do you need to get through the day? And sometimes it's as simple as like, I'm going to take a 10-minute break, which is so like, it's crazy, but it's true, like we forget these small little things. And, we as, I work part of a team here of nurses and doctors and there's social workers and dietitians and, physiotherapists and we work together. There's not very much of us, but like we bear witness to suffering every day. And that's just the way that we are. We are, as professionals, we are very empathetic people, and we absorb a lot of what we see. And there's a lot of pain, a lot of anger, a lot of hurt, a lot of fear, and we absorb that. And so it's taking its toll on us. But we do support each other. I'm so grateful to my family and my colleagues. But it really is. There's a lot of compassion fatigue, and it's a real thing. Burnout is a real thing. And so I really look forward to hearing what everybody else has to say. And I also do have some suggestions myself, which has been helping me kind of get through the day. But I'm really happy to see everybody here. And I just want to tell all of you that, I appreciate all of you.
Great. Thanks so much to all of you. Let's pull up my questions here. And so I wonder if you can give any examples of, situations in your workplaces that have affected, mental health. I think, Christine talked a little bit about that, but if there's anything that might make it, a little bit more real for people, that they can see sort of some of the things that have happened. Andy, I don't know if you want to start again.
Sure. It's sort of, it's like it builds on itself, right? There'll be a stressful situation, and then it doesn't get mitigated, and then there's just more stress on top of it. Like we're in the downtown east side, all over British Columbia, we're also dealing with the poison drug epidemic and ODs. And it hasn't abated during the pandemic. It's gotten worse. We just, we go through our workday and we do our best to do this in like a trauma-informed way, knowing that traumas that people have, in their early life or whenever, there's responses to trauma, and people do things that, you look at it and you go, why are you doing that? No, that's crazy. Well, it's normal. It's a normal thing that comes with this trauma, right? So we look through that lens. But then as you do that, you pick up that trauma, right? And then we have also trauma responses. And then it builds and it builds. And then some of our coworkers can't take it anymore, and they leave, and now we're short-staffed, right? So now these for me, the biggest stresses are coming from staffing. I've been doing this for a long time, and I have my own personal ways of dealing with stresses and trauma responses and stuff. But it's just like showing up for work, okay, am I by myself again today? Is something going to happen? Or is my coworker going to get called away to a different project? These are sort of the biggest stresses. I was reading the other day about something they call organizational trauma, and it's something that happens in the nonprofit sort of sector. It's because things aren't funded, and things just the way that they are, everything's on such a shoestring. So you pick up trauma from just the way that the organization is run, so just by being at work, it just piles up on you, right? And the whole time when we're trying to, help people through their day, we're just picking it up. I just wish there was more, more things just built into my workplace, society in general, just to help us, deal with things. It's it's tough. You were asking about situations that create stress, and I think that I just wanted to mention too that it's like, after doing this work for so long, I know people in the neighborhood, I know people more than I know my own family members, right? And when you just see them sick and suffering, dying and dying and dying, I mean, that's a huge stress. And I don't know, like, we're taught, overdose response, and we're taught, things on the job, but we're not taught how to deal with grief on this enormous level, right? And it just sort of hits you and bombards you. And coworkers tend to self-medicate with booze or drugs. We work in this crazy environment where extreme hard drug use is normalized, and kids come in and they work and they see this and they self-medicate and they burn out. We've seen coworkers OD and die. It's something else. I don't know. There's a lot of stress in this world, and there's a lot of stress in this line of work, and there isn't the equal amount of supports to get around it. So I'll leave it on that cheery note.
Thanks. Thanks, Andy. Christine, do you have any examples you want to give us?
Oh, sorry. Wow, I'm moved by what you said, Andy. Yeah, it really gives food for thought, and it makes me grateful for the fact that I work in an industry that is somewhat on the other side of that. But the same illnesses and addictions that you're talking about are in amongst coworkers. Maybe not to the extent that you're dealing with, but you can, when you work together as closely as we do in such a high-pitched environment with a lot of people, and you can't rely upon management as much as you would like, or as much as they would like to be there for you, because I don't want to be this about slamming my bosses, but you can recognize when somebody is wilting, if I can use that word. The things that we deal with have all along been the non-believers. This is crap. This isn't happening. Why are you standing behind that plexiglass? This is my right to come in here, and how dare you tell me? So we get the belligerence. And I've witnessed, grown men of, 50 verbally assaulting young women of 20 and telling them what they think, and the girls are crying, and the guy's still at it, or some other woman who's throwing something at somebody because you didn't get it right. The anxiety among the population in general over this, and the anger, is what we face every day. And we're always thankful if we don't have someone go off, but every day there's going to be someone who goes off inside the grocery store, or they're just going to come in without a mask, and they're going to disobey every single guideline. And that sort of sends the people I work with into a bit of a panic, because we're supposed to smile and greet and be happy and serve you. And how can we do that when you're being so disrespectful with our safety, with the safety of our coworkers, with the safety of the public around you? So the belligerent customers are not as few and far between as we would like, but they're out there. And we all hear about it when one comes in. Boss's response is too slow to get there. He can't be everywhere. So again, we band and we look out for each other. And as a shop steward, as somebody who has been given the opportunity to use my voice in my union, I'm quite firm on teaching others on how to stand up for themselves in a respectful way. Please step back 6 feet. I'll serve you, but you must step back 6 feet. Or no, you don't want to. Okay, then you're going to have to wait so somebody else will serve you. And then we learn to walk away. And that's the hard thing, is to walk away from the job when it's so ingrained to be that customer service person. I've dried many tears, both male and female, in quiet corners of the store. I've dried tears of customers who are breaking down when they finally realize they haven't, especially our elderly, they haven't been out in 3 weeks. They only come out every now and then, and they're gasping with that mask. And and they're scared. You can see how terrified they are, but they don't want to get kicked out, but they can't breathe. And it's like, okay, just lower your mask, stand behind the glass. We're 6 feet away to catch your breath, you know, and then you find out you're the only person they've talked to in 3 weeks. Your heart goes out to that. There's so much isolation. I'm very grateful for the coworkers that I have, and I'm very grateful that the 94.6% of the population in our community are trying very hard to do the right thing by everybody. But Andy, listening to you, I'm really moved, as I was by Easter, by what you're encountering. And when in the grocery industry, when you're called a hero and you don't feel like a hero, you're just trying to get through this day like everybody else, safe for your family. And then you hear of what others in other occupations are doing. I'm man, my hat's off to you, and thank you for everything you do. That's it.
Great. Thanks so much, Christine. Angela, do you have any examples you want to give us? I know you mentioned that you worked with farm workers, so I don't know if that's an area you want to talk about.
Sure. Of course, migrant farm workers from Latin America, the Caribbean, and basically all over the world. They come here, of course, and it's thanks to them that we have Filipino as well, of course, that we have all our fruits and vegetables, you know, and Canada needs them, so they come, of course. And it's a good program. They're paid minimum wage, which sucks for the service and the value that they have for the Canadian agriculture and basically, you know, food services. Or but yes, I support migrant farm workers, and you know, it's about the unknown. They don't know what this is new for them. Also with they don't speak English. A lot of them don't, some do. It's been very stressful. They come and they are in quarantine for 2 weeks. And there's all these adjustments that need to be done in order for our dear migrant farm workers to work well and safe in the farms. So there's all these adjustments that also and protocols that the farm owners have to put in place in order to protect these dear farm workers, men and women. It's been a huge issue. It's been a huge conflict, you know, because unfortunately, there are some farm owners that respect and keep the dignity of the farm worker, but there are others that really do not respect them. And I've heard time and time again of poor farm workers working 16 plus hours, cramped up in eight people to a little room. So all of that had to change. But many times it doesn't. And here in Canada, in BC, thankfully, the government took more control and put farm workers in specific rooms, hotels, with Vancouver Coastal Health there supporting them. In Ontario, it didn't happen, and there was a huge outbreak of COVID in the farms, and there were many deaths. Here, it was controlled. However, the stress and anxiety of the farm workers, not knowing how long they're going to work, the money, because back in I'll speak for Latin America, I'm Latin American. Things are so tough. They're not as organized. So it's a huge issue that affects them here and back in their homeland. And, little by little, people are learning. Government agencies are learning. We all need to work together. Yeah, I don't know what else to say about that.
Yeah, great. Well, thank you. Thanks so much.
Yeah.
And Easter, I wonder if you've got any examples for us.
Yeah. So in the hospital, I deal with a lot of trauma, and a lot of my colleagues, they all do. I just remember a story of one of my colleagues earlier on in the pandemic. She's a physiotherapist, and she was walking by this one fellow who was dying alone, and she just she was just so helpless, and it was hard because there was nobody around, and the family couldn't go and be with that person. And so there's so much trauma that we face every day. There's a lot of anxiety, there's fatigue, irritability, anger, a lot of restlessness, anxiety, and also like disengagement, from your team sometimes. If you're having to pick up all the slack, and because somebody is sick, sometimes you kind of build a little bit of resentment sometimes, but it's understandable, but it's difficult. There's uptake in mistakes, missed deadlines, really inability to focus. There's just so much going at you at one time. It's like my memory is totally shot, which is kind of scary. So, and it's hard. It's really hard to focus. It's hard to be productive. And so, people, I agree, like we need help. And I think like we have this thing in healthcare, right care, right info, right patient, right time. Like it's all about the help being there for us at the right time. And like that's one of the things that is lacking, is that we're not accessing that help. And I'm a shop steward too, and so I help support my members, and even what I do as a social worker, I'm always talking about finances, and where to go if you need to stop, if you can't work, what to apply to, like there's a lot of people do have some good resources available to them, but some people don't, and especially a lot of there's some young workers out there, and some small businesses where there isn't that social safety net. And so people are just coming back to work. They're working sick. They shouldn't be working sick. And so it's it's just a bad situation for everyone.
Great. And you've touched on this a little bit, but not everybody has to answer, but I'm wondering about barriers to some of the things that you need, whether it's from the employer or maybe from the government or beyond, from your sector, in addressing some of the things that you've experienced. If whomever just wants to start, you've got something to say.
Jean, so yeah, just some of the barriers, and that's it. It's like being able to access time off. We have and the thing with the pandemic is it's been now almost, we're going on 20 months now, right? And sometimes people have burned through all their EI and stuff. So supports are quite limited. And I don't know if people know already, like for a lot of people, like mental health, illness, injury, psychological injury, like you just don't get over it in like, 5 days or so, right? Sometimes this can take, a few weeks, months. And like our EI system, like for us and for me working in oncology, like some of my patients are off 6 months to a year, and some of us need that. And so there's not enough EI. EI is only 15 weeks, and then there's not very much after that. And unless you got a good benefit plan from your employer, for the rest of you, good luck. And sometimes if you're like a 2-parent family, you won't be able to qualify for like income assistance, right? So there's a lot of financial barriers. I don't know if anybody else can speak to that, but like those are a lot of the things that our patients deal with.
I'll second all that, Easter. You're absolutely right. And in my industry, there are those that have benefits because of collective agreements that have been negotiated for a long time. And we're very fortunate to have those benefits and grateful. But bringing up the new worker to the same standard is as anybody who's been at a bargaining table will know, is always tough. But what I hear the most of is once they've expired the company program where they can get so many sessions for free, but there's a wait list in order to get a qualified somebody to talk to, or maybe it's not quite the right fit for the family member that is requiring assistance, then it's a search for the help that they need. And you nail it when you say mental health isn't over in 5 days like a cold or another sickness. It's chronic for a long time. And being able to recognize it in your coworkers is so important as well. And that's what I try to really focus on in my own work environment, keeping an eye on everybody. It's always a challenge. It's a challenge to have Prince George is relatively large and has things around us, but I can't imagine what it's like up further north for those in Chetwynd or Mackenzie or Vanderhoof or Kitimat or some little hamlet even further west. And there's so many miles in between. And then it's finding a place to stay while you've got to travel for 400 or 500 miles, or maybe you have to get on a plane and go south. So something needs to be done to address that. I think it's been long overdue. Those are definitely the challenges with minimum wage paying jobs in the retail sector. And I can say that confidently with not just grocery stores, but the people who work in malls, the people who work in restaurants, the small business owners that can't afford it, or you can't book off sick because you might lose your job. It's just an underlying current that you know is going to happen if you phone in sick one more time. So maybe we need those sick days.
Thanks, Christine. Does anybody else have anything? So one of the things that we were wondering was if you think you've got, and what would be the ideal way to access the mental health care that you need, or that that your colleagues need. And we go back to Andy, and then you shook your head there. That's dangerous.
Yeah, I think one of the biggest barriers that my coworkers are facing is just access to services, like access to counseling. Our employer has sort of this in-house counseling service sort of thing. They've got a bunch of people, but you can't, everyone's booked up and you can't really see them, and it's a limited amount. It's difficult for a lot of my coworkers. They've got needs. When they see a counselor, they want someone who speaks to them, like they want somebody who's queer, trans, or a person of color, and the people that they have just don't have any interest in speaking to these counselors. and then we don't have it in our benefits. You can't go to your own counselor of choice and get it covered. So people just kind of do without, or, you know, you got to try to shell out of pocket, but nobody has money, and we don't get compensated what what we're worth, for sure. You know, I think that something that we all are really fighting for is to get psychological services covered on MSP. You know, our health, our mental health is our health. Why is it that it's so funny that our medical coverage doesn't cover you from the neck up? You don't get your teeth done, you don't get your brain done, right? This is huge. If it was as easy to access, you know, counseling supports or something as it is to go to the doctor to get some antibiotics, or to get your broken finger mended, it'd be great. We'd be doing it all the time. Another thing is access to detox and treatment. It's so hard to get into detox and to treatment, and these are things that come from stresses of work and, you know, just life and pandemic. And when they're not resolved, when, you know, people just try to work it out for themselves and it doesn't go too good. There's a real push in downtown East Side for safe supply, meaning, you know, a doctor can, or, you know, a health provider can give someone who's got addictions, just give them, currently it's like meds that replicate what they're doing with their addiction. You know, if they've got opioids, and they give them an opioid replacement or something. There's a real push for that. At the beginning of the pandemic, we've always told people, don't use alone, have your buddy there, have some Narcan. And then all of a sudden it became, don't hang out with people. So everyone's using alone. They're all, you know, it's just become super unsafe. I think that, yeah, access to easy and free access to counseling would be huge for people working in our sector, and myself and my friends and co-workers. Access to detox and treatment for workers and for, you know, our residents. Safe supply. These are the things. These are the biggest things that I hear over and over and over and over again.
Great, thanks, Andy. Angelo, how about you? Are there any things that you think accessing would make a difference, or how you?
Yeah, I just want to respond a bit to Andy. Andy, you know, Watari Counseling Services offers free counseling services. But I just want to talk a little bit about that. In Watari Counseling Services, we are 7 counselors, and we service a lot of people. And unfortunately, there aren't that many free counseling services in the downtown east side. So all my colleagues, they have a huge caseload of people, you know, and they do it with a heart, you know. But that is also something, you know, we need more of that. Absolutely, Andy, absolutely. However, having said that, I'll connect with you. I would like to connect with you and see how me and other counselors can help out the folks where you work at. Access. I also work with Indigenous communities groups here in the downtown east side, Vancouver, and I'm learning so much from the Indigenous communities here and people, and also in Latin America, my family, communities that have been in struggle for way longer. This is nothing new, you know. This is something that I'm learning that really helps me in terms, you know, one thing is policy, one thing is the medical system, which doesn't really change. It hasn't really changed, and it's trying to support, but within a system or a policy that makes things very difficult to actually access, as we all know, access the right care. Indigenous communities face that all the time, but they have their own medicine, they have their own healing, they have their own way of connecting. Of course, they use the medical system, but there's much more than that. And I'm so grateful that I'm able to learn from people, Indigenous people here in the downtown East Side and organizations, to use that, to use it for myself and to give it also to community. So that's something that I think the medical system needs to really take more into account. There are communities in struggle that have been struggling for hundreds of years, and they have learned how to deal with a lot of challenges. And why does the health authority think they, they have the answers? It's very important to know that there are many communities that have so much wisdom that can be employed or put into implemented, into the system in order to support community in a much stronger way for healing. So access, I mean, people don't like going to hospitals. They hate hospitals. Unfortunately, there are things that are changing, definitely. And there is initiative, but the change is so slow. It's such a slow change. So resilient communities, they look at their own medicine, their own healing, and I'm so grateful for that, because it's helped me also help other communities.
Great, thanks so much. Thank you, Angela. Easter or Christine, do you have anything to add to that?
I really appreciate those comments, Angelo. You're right. There is a lot of healing places within our Indigenous communities, and the elders do have a lot of. There's something powerful about ceremony, and when you are away from your people for a long time and the noise and clutter of the world comes in at you, there is a way to find peace, and it is returning home to your community, to the right elders. And it would be great if the medical system would capture some of that. And that's why we need more and more of recognition for what this natural healing, this true healing can be. In Prince George here, probably 70% of our homeless are First Nations and Indigenous. And there's more than there's ever been. And it's really hard to see, but I'm very happy that our Native Friendship Center has really stepped up in many ways to help wherever they can and whenever they can and whoever they can and whoever's willing to accept it. There has to be that point to it as well. There has to be those hands reaching out for help, and there's hands that will receive them. Thank you, Angela. Angela, that was really great to add.
Easter, do you have anything?
Thank you, everyone. Yes, and I totally agree, Angelo. I always, as a social worker, I always look at things as a holistic approach, and we bring that piece in, and not just looking at the medical system. It's not the end all and be all, but families and communities and also spiritual as well, right? And so those are all kind of resources that we can draw upon. I just do really want to mention something. Stigma still continues to really be a major barrier to us receiving a lot of services and accessing services. And there's stigma in communities and in some other, more marginalized communities as well. And as, Angelo and Andy very well know. And so, I think in terms of what supports we would like to see, we need, we definitely need access to resources and counseling. A lot of it is gated too, it's like you have to fit within a certain criteria. And some people don't feel safe, like even going to their EFAP, like some people don't feel safe doing it because it's kind of connected to their work, or dealing with children and families, like getting counseling from the ministry. Like it's hard to access those services, and there's fear of child protection issues and things like that. So there's a lot of there are resources, but it's not easily accessible. The other thing too is we don't have, like, some of our members in Health Sciences Association, we don't have the same kind of the same benefits, such as presumptive coverage. That's a real we're doing a campaign right now, asking the government to expand work safe mental health presumptive coverage to the whole team of healthcare and community services. So my union, we don't just we're not just members of people working in the hospitals, but we also have a number of community and social service workers too, and they experience trauma on a daily basis. And so we're like accessing WorkSafe BC benefits, like accessing benefits when you've already been like psychologically injured it is really, really challenging and difficult. And so one of our, and it's not a silver, but one thing that would make it easier for us is to be able to fast track those claims. We don't have to prove ourselves, that we've been injured, like we're struggling, and it's awful, like having to do paperwork and bringing up the issues again. That's not helpful. And then I know we've been a strong supporter of the 10 days of permanent sick leave for all workers. Like that's something that's really important that, that we really want to get from the government. And, we need leadership. We need real investments into mental health. We just don't need talk. We need leadership. And, I think we can all, we can all do that on our own, but it really, we need help from like at a higher level. And yeah, it just needs to be, the government's doing well too, like they're accessing, like I'm seeing more social workers. I'm seeing more of me. We need more of me too, just like, and then we take a holistic approach, right? So it's not just like, it's not just like mental health and psychological health too. It's like we advocate for those socioeconomic factors, like finances, income, food and all that kind of stuff. So, yeah, and we're there, these primary care clinics, we need to expand more of that. So when people do go to their family doctor, yeah, there's also a social worker there too, and so it's easily accessible for them. And yeah, there's a lot to be done. But even just from personally, like I said, I've been doing my personal check-ins every day. But getting help from like others, our families, our friends, our co-workers, and then I've been reaching out and doing these mindfulness apps, which have been helping me on a daily basis. I meditate every day. I can't go without it. I need to do that every morning as part of my routine. And we do have resources, nature, being out in nature and going out and just taking that time for yourself and getting out there and, just, being in nature and smelling the trees and the air, and yeah, just, little things that make a big difference.
Great, thanks so much, Easter. So we've got some questions from some people who are here. Someone is wondering, what role does community and team play for your resilience? If anybody just wants to answer that, or.
I would say that our team, as far as coworkers, to everything, I work with various, there's a lot of casuals that come in here and there, but my core crew that I work with, it's everything. We often talk about, you'll see in the media, or you'll see in the whatever, the regular world, people criticizing how things are going on. Oh, drug addict, finally just go get a job. And we kind of amongst ourselves, we just say, I can't listen to people who don't know anything about anything, and they come and they criticize it. They think you don't know, you don't have a clue where you're starting from. And being able to have coworkers with shared experiences like this, and we can just bounce things off, and we just sort of innately know what we're going through, is everything. Like that, my work coworkers are by far my number one support in getting through this. And it's not even, maybe you don't even get any, sound advice or tips and tricks to get through daily life. It's just having somebody there, knowing that we're going through the same things and we're experiencing the same things. And it's just, it's huge. It's endlessly huge. And without them, I don't know, I'm sure I wouldn't be able to continue to do the work that I do. And, kind of community, I kind of feel it's one and the same, there's yeah, anyway, yeah, the team's huge.
Thanks, Andy. Yeah, Christine, you had something there.
Yeah, I'm agreeing with everything you say there, Andy. It's really important that we have the community of our coworkers who we can feel safe and trust. And I work in an environment. I have 160 coworkers, and one of the things that I've been really pushing for and playing around with and mentioning it is that I think it would be important for work sites like that to have several people with the health and safety and mental health. There's a 3-day course, so I hope to make that a bargaining submitment. I think that would be really helpful for a lot of larger workplaces, just so that there's people who can recognize when somebody's off. You have to be seen when you're feeling alone and you're feeling the depression get too much for you, you feel invisible. It's really important that there's that one person you never thought of who can see you. And I think that there's people out there like that in my workplace and in other places. My husband works in a pulp mill. I know for a fact they have nothing like that. It's a big gender, it's all guys, you suck it up. But depression is really high there. And then for those who work in isolation, like our own home support, because UFCW does have a healthcare sector, it's home support workers, and they go into people's homes and help those that need it, elderly, people who have disabilities, they're dealing with families, all the rest of it. It's important that all aspects have somewhere to outreach. And I think that if we can address some of it through WorkSafe and make it part of our collective, that might help. And Angela, I have a burning question for you, because I know that you work with migrant farm workers and how do you deal with this there? I just have to ask you, who recognizes it? Who recognizes when someone's off, or what do they do if they're sick?
Luckily, here in British Columbia, there is and Watari and other amazing migrant justice healthcare groups. They really work closely with migrant workers. Watari helped all the migrant workers that came in 2020. So they have our number. we have a specific staff that work with them. So there's a constant communication. Also, Watari and other organizations go to the farm, go to the farms, talk to them in person. Also giving them supplies, different types of supplies, even bikes. So I get my colleague, who actually is the one that works more directly with farm workers. Last year I worked directly, but now I'm in the downtown east side as well. But when she can, she gives me some folks to support, because her caseload is huge. So yeah, I don't know if that answered your question.
Yeah, it's interesting, as I do communications work, and as a volunteer, I was involved in the healthcare thing, and I learned about some of the services that some medical people were providing, and I thought, holy cow, that's an amazing story. But they said there's no way that they could talk about it because they couldn't jeopardize the relationship that they had with the farm owners to be able to go and provide services. So it wasn't something, I think it's the kind of thing that a lot of people would be interested to know about, and hopefully there's a lot of it happening. So one last question. It seems a little odd, but maybe it's a good way to end. Someone is wondering about humor, and what role does humor play in terms of resilience? If anybody wants to take that one on.
I will, just very quickly. The Indigenous communities here have so much humor. They're like laughing all the time, making jokes out of everything. And that is laughing medicine. That is such a huge part, because many communities who have been in struggle, they know that is, if there's just pure seriousness, then we go down. So that is a huge part. That is a huge part. And just very, very quickly, the other question, our dear executive director of Watari, in terms of community and group, I 100%, Andy, what you said. Our executive director allowed us, the counselors, go on a 2-day retreat outside of Vancouver to connect and reconnect and absorb each other's strengths and wisdom. And that just made things, when we came back, we were energized. So executive director, she knows the importance of community, of coming together, of helping each other. So that's something that also, people in the higher ups, they have to really be aware of that. And we're blessed and grateful that we have Ingrid Mendez as our executive director at Watari.
Yes, you have to laugh every day, and you have to laugh at the craziness around you, or it'll drive you crazy too. And being in an industry where we serve the public daily, there's lots to laugh at. I prefer to find someone to laugh with, because there's a big difference in that. And yeah, humor is used a lot, and I can appreciate the Indigenous humor, because being Métis, I have a little bit of that myself. So yeah, it's really important for us, our world. Yeah. Thank you.
And Easter, did you have anything to add to that?
Oh, no, thank you everybody for being part of this panel. Yeah, we do need humor in our job. It's like every day after work, I meet up with my best friend who's also a social worker, and we just debrief, and we just can't believe sometimes how our day goes, and we just have this, we just laugh it off, because that's all we can do really sometimes. But I just want to thank everybody for all their really wonderful insights. This has been really helpful, definitely.
Great. And thank you all so much. Yeah, it's been wonderful. I'm hearing from you. And I think Edith is going to give us some.
Thank you so much. It's just been such an honor to listen to all of your stories and your resilience. I was so moved by each and every one of your experiences, and just thank you so much for sharing. We have a couple of quick remarks from myself and Tanya, so if we can hang in there just for a couple more minutes. But again, it's just been such an honor to hear all four of you. And so we've heard a number of really good examples from your own workplaces, from your own unions, of examples of employers or unions offering supports to their members and taking on different campaigns to advocate for their members' mental health needs. And so I think there were a couple of examples in the chat, the HSA presumptive coverage campaign, as well as BCGEU also had a presumptive coverage campaign that is ongoing. The BC Teachers Union, BCTF, offers a program called Starling Minds, which is an online mental health toolkit to teachers and their families for free. There are also, good examples of non-union organizations offering specific supports to certain workforces. So Care to Speak is a peer support service that provides emotional and psychological help to healthcare workers, and it's available free to any healthcare worker in BC, regardless of profession and employer. Funded by the province, run by CMHC, the Canadian Mental Health Association. Angelo mentioned several times the amazing resources and programs from Watari. So thank you so much for bringing that in, Angelo. And I think as a coalition, the BC Health Coalition really wants to suggest that, like workforce specific supports, they're useful, they can really help sort of shift the dial in what's possible for workers. And I think we just need to go further, right? Like it's so patchwork depending on where you live, on who you work for, what your benefit package is, if you have benefits at all, or if it's very limited. And so, we have seen some really positive improvements. So there's like with primary care networks and primary healthcare starting to be expanded in some areas across the province, including counselors in primary care is really positive, including more social workers in primary healthcare in the community that anyone can access. That's really positive, but it's like very early days in increasing access. And so I think it's no surprise that the Health Coalition wants to see solutions that work for everyone, regardless of employment status, regardless of income, or whether or not you have a union to fight for you. And so, absolutely, Angela, I totally hear your comments about, the medical system can only take us so far. And we really have to listen and pay attention to Indigenous leaders who have so many lived experience to offer us in terms of how to heal. And so I think universal publicly funded mental health care is a part of that, could be a big improvement, and it's not the end goal. So I'll turn it over to Tanya for a couple of quick minutes about what we're hoping you'll join us next.
Yeah, thank you, Edith. And I just want to reiterate my thanks to all the panelists also for all the heartfelt stories. So we have an invitation for you. We ask that you join us on November 25th from noon till 1:30 for the second panel in this series, where we're going to dive a little bit deeper into a conversation about what public mental health care could look like. If you're wondering how you can support workers' mental health today, you can follow the links in the chat to our website, where you can find links to current campaigns that you can support that are working for better mental health supports for workers. Finally, we'd like to hear from you about the types of events and topics that you'd like to see the BC Health Coalition take on. We've created brief priority survey that will help us know where to put our focus. There it is. And you can find the link to that also in the chat. This is our first event that focuses on mental health. So if you want more on the subject, fill out our priority survey, and yeah, please let us know. So again, thank you so much to our panelists and to all of the folks that came together to put this on, for everybody that was able to attend, and especially a heartfelt thank you to all of the frontline workers for all of the work that you do every day. Let's work together so that showing our gratitude comes with action as well as words, so that we can get you all the support that you need to be well and healthy in every sense of the word. Thank you so much.
Take care, everyone. The link of this recording will be shared in a few days, and we just so appreciate your time today. Be well, everyone.